got because we got them around instead of or mouth area. That's what's called malaria. It's a bad air that you're breathing in to like get the infection. But it's true. I was like, whoa, that's crazy. I didn't even know. Anyway, and I keep going. That was I was like, oh, it's going good. I'm just gonna get 2 weeks before the first time. But it's going good. My first test. I just was because people got my treatments on, but like she gave this to everything. That will be just going.
Okay, this is the overhead where we were last, and we had basically, we were looking at the arch. And the major vessels of the arch. So we were on the common carotids, which are these two. And we've gone over the fact that the external carotid has about 6 or 7 vessels you're going to be learning. Okay, we didn't go over all those. And that the internal carotid goes to the brain. And then we stopped with the vertebral artery that also goes to the brain. So what we want to do is look at the brain. What the arteries line the brain. Okay, and I mentioned that it's a little bit unique in that we have 2 major arteries going to this one organ. The internal carotid, cut off right there, it's going to its branches, and the vertebral. And if you look, more or less, if you drew a line right across here, this posterior part would be supplied by the vertebral artery, and all this anterior part by the internal carotid, more or less, okay? But there's something else that's a little bit unique about this, in that right here, there's a little artery called the posterior communicating that hooks up the common carotid with the posterior cerebral. Blood can go through that little artery either direction, depending upon the need. So, for example, if there is a problem with the vertebrals and we're not getting enough blood to the vertebral arteries, the internal carotid can send some down to the posterior communicating. So go from here to here and help out. If there's a problem up in here, then the vertebral can send blood going through this in the opposite direction. So they can help each other out through this little vessel that blood can go either way. Okay? So that's a little bit unique as well. So this is the brain, and so that's the common carotids are taken care of. So the subclavian. Subclavians that come out to the upper extremity. Okay, you're only going to be learning 4, 5 vessels, basically, that are part of the upper extremity. Subclavian, axillary, brachial, and a couple down the arm. You've got the street back here called Boulevard. You get on Boulevard and you go south. You're driving along, all of a sudden you look up and it's become Martin Luther King. And if you keep going far enough, it becomes Eastern. Same street, different names, just because of the area of the town that you're in. This is an artery that does the same thing. It has three names because of the different area that it's in. So when it's underneath the clavicle, we call it the subclavian. But up in the armpit, you call it axillary. In the arm, you call it the brachial. It's the same vessel, okay? Just has different names. So make sure you pick up on that, and of course, you'll find out where you can call one and the other. Okay, so and then the brachial is going to divide into the radial and the ulna, and obviously there's could be an empty seat over here, I don't know. Okay. And of course, you know, on the side of the thumb is the radial and you have the ulna. So basically, that's the blood going to the arm. So that takes care of the arch. So let's next one, of course, is the thoracic aorta, which would be this one right here, thoracic. You have one vessel you have to know off the thoracic. That's the posterior intercostals coming down here. So there's not that much on the thoracic. So that means we can go right on up or down to the abdominal aorta. So let's draw in the abdominal aorta. Let me draw the diaphragm. Okay. The abdominal aorta has two major types of vessels, paired and unpaired. So let's just kind of go through the pairs. Couple here, couple here, couple here, couple here, several in here, and of course these two. So that means, of course, they're going to go to both sides. And for example, these two would be the phrenics, which go to the diaphragm. You've got an adrenal gland on both sides. That's what these would go to. Obviously, you have a kidney on both sides. What these would go to. The renals. These little wiggly ones going down here are going to the gonads, the testes or the ovaries. A bunch of these lumbars, and then of course the iliacs down there. All paired. Okay? And you can see these up here. Kind of hard to see a couple of those. Paired vessels. But of course, there's something missing. Taken out of the abdominal cavity. That's the digestive system. You don't see. And all of those have, like, we've only got one stomach, we've got one liver, and so forth. So we're going to have three vessels coming off the aorta that come off the ventral part. One right here, and another one. Celiac, superior mesenteric, and inferior mesenteric. So these three major arteries are going to the digestive system and its associated organs. The celiac goes to the upper half, more or less. Okay, we're talking about the abdominal area. The upper half. Okay, the superior mesenteric and inferior mesenteric go to the bottom half, superior on the right, inferior on the left. So all of these organs in there will be taken care of. And of course you can't see those there, so let's put those organs in place. And there's going to be vessels, a few vessels you're going to learn coming off of those as well. So you're going to learn branches of each one of them. And we're not going to go over those now. But here's the celiac way up here. Here's the superior mesenteric, inferior mesenteric, and of course all the organs that it's taken care of. So these are the three unpaired vessels. Okay. Takes care of everything except the legs. So we have the femoral. Now the legs, of course, up here we've got the iliacs, and it doesn't show it very well, but there's obviously from the common iliacs, there's an internal and an external. The internal, you're going to be seeing that, and that's it, no branches. But the external, right there, changes name and becomes the femoral. So it's one of those, it's just called different name because of a different place. So here's the external iliac, here's the femoral. And then you got a couple more. You got a popliteal here, posterior tibial, anterior tibial. You've already seen, and you saw the posterior tibial a lot. You were all calling them a muscle. Okay, you remember the flexor hallucis and flexor form that you were learning on the leg, and between them was the posterior tibial artery. Okay, so that's what you were calling another muscle for a while. Anyway. So it's not that much on the legs. All right, so we've got all the major, we took all the four major parts of the aorta, kind of outlined where they were. We talked about the major arteries coming off of those. Now, I haven't taken those any farther, but you're going to be learning some arteries. So now we can talk a little bit about blood flow. So this is your aortic blood flow. Okay? And so let's kind of talk about how this thing is set up. All right? You already did the blood flow through the heart. And you started the superior vena cava and went around to the trip to the lungs and back and ended up in the ascending aorta. So that's where you are now. So arterial blood flow, every one of them starts in the ascending aorta. So what I've done, and to get everything on one page, you'll note that I have abbreviated the parts of the aorta, A, B, C, D. Okay, so you get down here. So, all of you are in the ascending aorta, but they're not all going to the same place. Some of you are going to the pancreas. So let's find out, how do you know what vessels you're going to? So you find the pancreas over here somewhere. And if you look, you'll see right here, duodenum and pancreas. So I put the two together for our purposes. Duodenum and pancreas. So we start off on A, which is the ascending aorta. Then we go to the B, which is the arch. And obviously we're just going to go through, because the arch doesn't take us to the pancreas. Then we're going to go through C, which is the thoracic. I don't think I do anything off. I don't do the posterior intercostals here, so you never go through there. Here's the abdominal, back down here. The abdominal, which is D. And you're going to take the celiac route, okay? So when the celiac comes up, you better get into the celiac. You want to get to the pancreas. And then, as you go, there may be other branches. So you have to figure out what branch are you going to take. So you're going to take the common hepatic, and then from there you take the gastroduodenal, and from there the pancreaticoduodenal. And So that's all farther we're gonna go. Obviously, there's another branch, but, you know, we're gonna stop it at that. So pancreatic duodenal, and you are at the pancreas. Okay, so that's the blood flow to that particular organ. So all of these are individual blood flows going to an organ, or maybe a part of an organ, or it could be just a specific body region. And it depends here, like here we are going to the right face, that type of thing. So all of those, you know, as you study the blood vessels on the models and so forth, and especially on the cadaver, and you might want to just follow along, see how much of that you can do. You know, find out this particular vessel, where is it going that you're learning? And where did it come from? You know, just kind of keep going backwards and forwards and getting an idea of how everything's put together. Okay, so you can try out a few of those and see how you do. You know, later on, I'll tell you how I approach this on the test, you know, after the fall break. Okay. Okay, so that's the arterial system. All right. Now we're going to go to the venous. So we got blood, obviously, to all these different organs. Now we got to bring them back to the heart, take it to the lungs again, so forth. So, can you tell any difference from the venous circuits compared to the arterial circuits? And there's a couple of major differences. One of them you probably wouldn't pick up here, but one of them you may. Now I'll point to the hand to kind of clue you in there. What does it look like on the venous circuit? More. In other words, you got a lot of more possibilities on getting back